easy to understand terms. Now, here is Dr. Robbins.
Hello, everybody, and welcome once again to a live broadcast of Doctor of Functional Medicine with me, Dr. Howard Robbins. And the last few weeks I've been traveling, and when I travel, I put on repeat shows that are commonly listened to. So when you see encores, you know that I'm somewheres lecturing. Occasionally, I go away for a vacation, which I want to start doing more of. But the shows that we put on are the ones that people are constantly going back in episode directory and listening to. And that is what one of the most wonderful things about Voice America is that we have episode directory where you can go back in and listen to all the different shows that we've done. And as you may or may not know, if this is the first show you're listening to today on stem cells, the shows are geared towards helping with specific health issues, specific problems, specific modalities, health modalities, with the intention to tell you and help you learn about safe, the very important word, and effective, the next most important word, ways of treating just about every disease and condition that's out there. So that's what the show is designed to do. That's why we do it on one topic generally at a time. It's not a what I call medical news show on all the latest things with 2 minutes on every new thing that comes out. Excuse me. So that's that. I'll be here for the next month or so doing all brand new shows on new topics. Sometimes we revisit old topics because there's more and new information to bring up. I have to thank our sponsors, which are very important to you on this show. Promo Life. You can contact them. Go to their website first, see what they have. Promo Life makes the finest ozonated products that you can get anywhere in the world for people to use at home. They're always coming out with new and innovative things, including they now have an ozone water device that you can make ozone water in just a few minutes at home that works really well, and it's really inexpensive. If you call them at 866-472, excuse me. That was the station's number. Apologize. 888-742-3404. 888-742-3404, and tell them that you heard about everything here on Dr. Howard Robbins' show. They're going to do something special for you. And their ozonated oils are without exception exceptional. These are things that you want to go learn about. You can listen to some of the shows that we've done on ozone home care, ozonated oils, and learn how you can do rectal insufflation and ozone enema, so you can absorb some ozone into your blood and help treat medical problems, not necessarily get rid of them because it can only absorb so much, but but you can get their ozone elite machine with home care setup. And if you tell them you heard about it here, they'll do something special for you, some percentage off or something like that. Also, very important to you if you're interested in stem cells is Doctor's Biome. Doctor's Biome is a very special probiotic beverage. There are 15 patented strains of next generation bacteria. That means they're created to survive the stomach over 90%, because capsule, powder, and tablet probiotics are destroyed over 90% in the stomach. These are created to survive the stomach acids and bile salts, and when they reach the gut, They're called smart probiotics. Smart probiotics are actually created to stick to the cells in the wall of your gut where they're needed to get yeast in balance, kill off bad bacteria, and help in the repairing of the gut wall. So you can absorb all those wonderful nutrients you're getting from the food you eat and the supplements you take. And it's delicious. It's in a 100% organic mint, kale, lettuce, cucumber, celery, apple, lemon juice. So children love it. You can give it to babies. Listen to the shows that we've done on probiotics. You'll understand why this is such an important and special product that they're almost not able to make it fast enough. If you use the coupon code radio20, you'll get a special discount. And then in the future, you can go on auto ship and get a 10% discount or future orders with priority shipping. Because when they run out of it, now they're running out of it frequently because it's being sold all around the world. As this show is heard in over 80 countries, it's being sold all around the world. Free shipping here in the continental US. Otherwise, you have to pay whatever the shipping charge is to get it to your country. And they're always looking for new distributors. So, but bottom of it all is you won't be sorry because it comes with a 100% satisfaction money back guarantee. You can't lose. You can't lose. You can only gain from this. Everybody needs it. It's not something some people should take. It's something everybody should take. If you need water to live, oxygen to live, and if you want to grow old and be well, Doctor's Bio. Now let's get into our show. Try to get in a little early because we have so much to say. So first of all, what are stem cells? Why are we doing this show? Okay, let me give you an example. Peter, who is a patient and a very good friend of mine, when he was 74 years old, suffered a heart attack. And they told him that the bottom, the inferior wall of his heart was completely destroyed. It will not work again. And when the heart pumps out, they call it the ejection rate. He had a 38% ejection, which is not terrible, but certainly not great. He was coming in to get ozone therapy, intravenous ozone therapy, for other reasons. 3 months later, he had to go back for a checkup. So he goes back for his checkup, and the inferior wall of the heart was completely repaired. It was working fully. His ejection rate went up to 63%. He was ecstatic. The doctors couldn't believe it. They had no idea. They just couldn't understand how this all happened. Why it happened? Stem cells did the repair. How? As you're going to learn a little later in the show, ozone stimulates natural stem cells to be made in the body. So now let's get into this miraculous thing. If you read, the beginning that I gave you here for this show, it said, pretty much why you should be listening to it. Stem cells are unique cells that have the ability to divide and differentiate into various different specialized cells in your body. There are two basic types: embryonic stem cells and adult stem cells. The embryonic stem cells come from, the embryo, early stages in embryonic development. And they're also harvested from the placenta, from the blood when a baby is born. There's where we run into some issues that you're going to learn about. Adult stem cells are found in in various organs and tissues in your body. And stem cells have the ability to fix the unfixable and repair the unrepairable, as I just taught you, in your body. Um, they can replace damaged cells, disease cells. They can enhance wound healing. That's why nobody beats my wound healing. I do in days what take, you listen to the show we did on wound healing. I do in days what would have taken weeks with even all the new age things they're using in traditional wound healing hospitals and clinics. I do in days what takes them weeks, and weeks what takes them months. And sometimes I'm able to heal wounds that can't be healed by all the new methods that they're using and all the new devices that they have for it. We just amazing results with ozone in healing it. And why has to do with some of the abilities of stem cells, a big part of it, which is why I lecture at the American Academy of Stem Cells big meeting this past October. And I will be lecturing coming in March of 2025 at their their next big meeting again. Ozone has the, ozone, yes, but stem cells also has the ability to destroy cancer cells. And at the same time, not damage, but preserve, not only not damage, but preserve healthy cells and healthy tissue. So what are stem cells? Basically, another name for it would be called, they're the body's master cells. They're special types that have important properties because they're able to make more cells like themselves. So in essence, they self-renew, okay? And they can become other cells in your body, all right? So they can they can transform, I guess is the best word, in a process that's called differentiation. And in this differentiation process, they can become a liver cell or a kidney cell or a brain cell, an eye cell. They can become new cartilage lining a joint. They can become a muscle cell, a tendon or ligament cell. That's where prolo-ozone therapy comes in. If you've listened to the shows that we've done on prolo-ozone therapy, but we'll talk about that in a little bit. You'll understand how they can repair this tissue and that you thought would never be repairable. You may have watched movies in the past. I forget the name of this one, Brian's song, maybe it was. Anyway, there's movies about, okay, a football player gets a back injury and he's never going to walk again. Not only does he walk again, but he goes back and becomes a football star. And the reason these kinds of things are possible is because the body stimulated, and all the different things that were done stimulated natural stem cells, and the stem cells went in and repaired the damaged nerve tissue so that the person was able to not just walk again, but run again and exercise again. So stem cells are found virtually in almost all the tissues in your body, and they're needed not only for repair after an injury or if something harmful is happening to you, but also for maintenance of the tissue in our body. One of the unfortunate things is as we grow older, our stem cells tend to weaken in their numbers and in their abilities. So we need to stimulate their activity in the body. And there are ways that this can be done. So if you stay listening to the show, you're going to learn about that. So embryonic stem cells are probably the most versatile, and that's why they've been harvesting them from uh, uh, when mothers give birth, they have the placenta with um, uh, the tube that goes into your belly button, and this is where there's embryonic blood, and they take that embryonic blood and they can harvest stem cells from it, and then use that and re-inject it into muscles, tendons, ligaments, joints, discs in your body, and help in the repair and the recreation of the muscle, tendon, ligaments, and joints in your body. So stem cells can become brain cells, heart muscle cells, bone cells. Virtually, they can become any kind of cell that your body needs. Okay. What we don't know about stem cells is way a humongous amount. They're constantly, it's being studied now to try to come up and find out the mechanism of action, how all these things transform and create. As much as they learn, that's how much they learn they don't know. All right. But no other cell in the body has the natural ability to generate new cell types. They can be guided, and that's the key thing. They can be guided into becoming specific cells that can be used in all of us to regenerate and repair tissues. And that's the key to this whole thing. So people who have cancers like leukemia and Hodgkin's disease, non-Hodgkin's lymphoma, and other cancers have been amazingly helped with stem cell therapy. Apparently, the best part about it is they don't form tumors themselves. So they're not going to become a cancer tumor. They're going to help get rid of a cancer tumor if they're going to work at all. Aplastic anemia, people with immune deficiencies, metabolic deficiencies and problems, all can be helped by this. Patients with type 1 diabetes might get over type 1 diabetes from it. Parkinson's disease. It's maybe one of the reasons why we're so successful in treating Parkinson's with ozone. ALS had great success with that. This is probably one of the reasons why we've had great success in treating it. I already told you about the heart, osteoarthritis, and other conditions. Stem cells are doing repair. And therefore, this is why maybe we have been so successful with ozone therapy. We're going to go to our first commercial breaks. Please stay with us. When we come back, we're going to talk more and get into this a lot deeper. So stay with us. We'll be right back.
Medicine with Dr. Robbins.
Hello, everybody. Thanks for staying with us. So let's get a little bit deeper into everything that we've been talking about. So embryonic stem cells are probably the best. They're the most versatile. They gather you can get it, as I said, they're going to take the embryonic stem cells out of the blood from the placenta when a baby is born. They're harvested that way. It's all moral and ethical. And these stem cells are what they call pluripotent stem cells. I said it so you can understand it. That means they basically can have an ability to divide into more stem cells, and they have the ability to become just about any kind of cell in your body that you need. And this is how babies' organs get formed and everything. And this is why the embryonic stem cells can be used to regenerate or repair diseased tissues and organs. Unfortunately, And I'm not sure if this is going to hold up, or if our FDA has started to put a ban on using these embryonic stem cells. At least this is rumor that I've heard. I haven't had the time to check it out to see if it's so, because there are companies that have been harvesting these stem cells and getting them prepared so that you can be using them in stem cell therapy by the doctors who specialize in it. And I believe you could probably go to the American Academy of Stem Cell Physicians website, or contact them and find out who does it in your area. But these are the most powerful ones that you can get. Now, if that's going to be the case, the other types of stem cells that you get are basically what we call adult stem cells. And unfortunately, they're not found in as large numbers, but basically they are harvested from bone marrow or fat. Now, to be fair, my experience with patients, and perhaps I've only seen the failures, never the successes, but harvesting them from fat is kind of easy, but unfortunately, they're not very powerful. They don't seem to work so well. The other side of that coin is bone marrow, which I believe is not a particularly comfortable process of harvesting, but at least when patients have had bone marrow transplants and harvesting of them, they seem to work much, much better. We've heard of some wonderful results that way. Intravenous ozone therapy, particularly we know the direct IV method that we specialize in, and we've only done it 300 to this date, for this show when it's being first aired, over 370,000 treatments over the last 29 of my 34 years doing intravenous ozone, proving not only its benefits, but its safety. Okay. So I don't care what you read on the internet or what others tell you. Obviously, I've proven safety, because here in New York State, they don't care if I kill people with pharmaceuticals. But if I hurt one person with ozone, I'd be out of business in a heartbeat. So our record speaks for itself. What ozone is doing is stimulating natural stem cells to be made by your body, mostly, I guess, is in the bone marrow, because that's where the most powerful ones are, and to be made in larger amounts. Now, what scientists have been able to do, okay, is alter embryonic stem cells. And they're able to alter the genetics of it, in actuality, to make them what they call induced pluripotent stem cells, the iPSCs. And those stem cells have now been transformed into a cell that can do a specific repair of a body, of a muscle, tendon, ligament, joint, a spinal disc. Unfortunately, while they can inject it into your blood, they don't know where they're going to go. So will they go to the brain to help in repairing brain tissue? The answer is, with intravenous ozone, I've done some things that have been proven that it has to be not the ozone, which is there for about 10 minutes and it's gone, doing all the other things ozone does. But for example, I have right now, I'm treating a patient. He's 25 years old. He's autistic. And over the course of the past 8 or 9 months, we've seen some amazing changes in him. I have videos on all this, but some amazing changes in him, which obviously has to be the work of stem cells. It cannot be the work of ozone itself alone. True, we're removing toxic metals from his brain, which can stop progression of the damage that's being done that caused children, we believe, to become autistic. But how do you repair the brain tissue? We're taught brain tissue can't be repaired. Nay, 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 not true. It is very possible, obviously, to repair it because we've seen the results in patients with autism. And he's not the only one that we've seen or treated. So mesenchymal stem cells are a form of adult stem cells, okay? When you change, and they can make iPSCs out of adult stem cells, meaning they change the genetics of that cell into be a more specific stem cell to do a specific job, okay? These induced pluripotent stem cells, they can be altered and made into to do a specific job. Mesenchymal stem cells, okay, are multipotent cells, and they can differentiate into many different types of cells in your body automatically. And that's the type that intravenous ozone therapy, I believe, is stimulating predominantly. And that's why I see amazing speed in wound care. Bone, you can, it can differentiate into cartilage and ligaments. That's why when we take a knee, for example, or a hip, that's bone on bone, or all the cartilage is worn away. It won't get rid of bumps. So if you've already had a damaged joint, like in rheumatoid arthritis, it can't undamage the joint. But if you have a joint that's just lost all the cartilage over wear and tear, over use, over time, this can cause new cartilage to form. We've seen this happen countless times now in patient after patient. So MSCs, mesenchymal stem cells, have been very important in creating and repairing bone, cartilage, ligaments, muscles, tendons, and discs. MSCs, and now this is why we were able to fix Peter's heart, become it's called cardiomyocytes. Cardiomyocytes, I believe, is the right name, and vasculature cells. So it repairs the vessels, the blood vessels, and the muscle tissue in the heart. And that's why he was able to get his heart working again. So it wasn't directly the ozone working, it was it was the stem cells that were initiated by it. And when you're dealing with muscles, tendons, and ligaments, that's where adipocytes and osteocytes and chondrocytes come in. Vasculature cells will come in and help do repair. Now, the MSCs are found in many different types of tissues in an adult, not just, the fat tissue, the adipose tissue, and but in the bone marrow as well. If they're found in your skin and in your peripheral blood. And they get MSCs now from the umbilical cord blood, and that's what they're predominantly using. The embryonic stem cells that they're gaining, there's a lot of controversy over the ethics of it, because what if you take a dead fetus and you quickly, before it decays, pull the stem cells out? There's clinics, I guess laboratories, not clinics, that are taking, and creating embryos to be used just for that purpose. And this is where there's been a lot of controversy um, over the ethics of this, the morals and ethics of doing such a thing. But it's totally ethical, in my opinion, to take umbilical cord and amniotic fluid from the placenta. And these are the very young, very primitive stem cells that they're getting. Um, and some of these MSCs, I think they call it Wharton's jelly, have been proven to be beneficial because they can expand them in vitro, meaning in the laboratory, they can make more of them. And this is pretty much what gets injected. Now, I have to say, I prefer to do intravenous ozone therapy to treat all these things. I did use the amniotic fluid stem cells, the umbilical cord, I should say, the blood stem cells from a company. I had a close buddy who wanted me to try it for him because he had a limited amount of time to stay in New York. He lives in Tennessee. And we gave him a shot in his shoulder, a shot in his hip, and a shot in his knee. We saved the shoulder from needing any surgery. We saved the hip from needing any surgery. His knee became infected. And ultimately, later on, went on for a knee replacement. There is no such thing, and there is no possibility at all from infection with prolo-ozone therapy. Absolutely not possible. Not even one in a million, not even 1 in 10 million. Where there's always a chance to win Powerball or a state lottery, there is no chance to get an infection from a prolo-ozone therapy. It's without possibility, because ozone kills every virus, fungus, yeast, mold, bacteria, parasite, toxin, and harmful free radical. So there's no way you can get that. But when you are using the MSCs, apparently it is possible. It's not common. That's the good news. But when you're using those MSCs that you get from the umbilical cord blood from the companies, if they're still allowed to harvest it and sell it, well, it's very expensive. And it, unfortunately, I feel most people can't afford it, just the wealthy and financial elite. If people want to afford it, they have to save up, because those injections can cost 4, 5, 6,000 each. And so they're not easily affordable. Whereas prolo-ozone therapy is extremely affordable. Certainly in our clinic, because we charge the lowest fees, I think, in in North America. But otherwise, many of the clinics do charge hundreds of dollars. Thank God, not thousands of dollars per injection. But what happens is the cells get reprogrammed. And in the reprogramming of these cells, we're able to fix things that were generally considered definitely unfixable. MSCs, I think, mesenchymal stem cells, were first I don't know if they were discovered back in around 1990, 91 by Arnold Kaplan at Case Western Reserve University. But I believe he was the one who saw them and characterized them, and that and figured out what they're actually doing. Researchers, I just want you to, just repeat certain important things. So researchers have been able to take and reprogram these cells and create new heart cells. Um, there are many animal studies with heart failure that they had. What they did was they injected these right into the animal's heart, and the animal survived. I'm not a big fan of animal experimentation. For those of you who know me and have heard shows, it upsets me way too much. I can't even watch a Disney movie anymore. Um, I know they're not being hurt, but it's hard for me. Um, I donate money every year to various rescue organizations, dog rescue, and also to for the Akumal in Akumal, Mexico, the Akumal spider monkey rescue and animal sanctuary, where they take in all sorts of wild animals. Howard the monkey, spider monkey, is named after me. I just came back. Those of you who are watching this on my YouTube channel, Functional Medicine with Dr. Robbins. See, I have a little bit of a tan. I just came back from a trip to Mexico, and on the way to the airport, we stopped to pick up some water fast and in Mexico, and we saw a little baby spider monkey eating a banana. So I went inside, got water, and I bought another couple of bananas because I saw there were another couple. Suddenly, there were about a dozen of them coming out of the trees. Fortunately, spider monkeys share food. So we bought a bunch of bananas and we were able to feed them for that day at least. In any case, we're going to go to our last commercial break. And then when we come back, we're going to finish up with everything about stem cell therapy and how you can get it. So stay with us. We'll be right back. Hello, everybody. We're back again. We're going to finish up on stem cells now. So stem cells are going to help, work, as I said, just to, summarize, with self-renewal, because they can they make more of themselves, and thus they can go on and work to do all the different repairs in the body. They have been used in targeting cancer treatment because while they'll go after and destroy cancer cells, they don't they preserve, they don't harm healthy tissue in your body. They can repair just about anything. They can do just about anything. And this is the most amazing thing that you can imagine. Now, how can you get some care? Well, first of all, you can do rectal insufflation at home for those of you that can't get intravenous ozone therapy. Rectal insufflation is simply an ozone enema, and you can do it, build up the amount you get twice a day. 750 to 1,000 cc's of oxygen and ozone gas at even a 40 or 50 microgram concentration. Listen to the shows that we've done on ozone therapy home care, and it goes into more details about it. Companies like PromoLife, PromoLife itself, I can't say for other companies, also will be able to give you support around it. And I believe they have videos that discuss it on how to do it. It's real simple, it's real easy, and even a baby can be given a rectal insufflation, although they shouldn't have a need for stem cells, that's for darn sure. And while it doesn't compare to intravenous ozone therapies, it does have some strong benefits, making it worthwhile to get set up for home care. Now, we know that the direct IV method, where we push the oxygen and ozone gas directly into your veins, will do all the things that we have been discussing here. It's been proven clinically, so we know it works on many different levels. But most importantly, you need to go to a doctor who's been trained in it. They shouldn't be just experimenting on you, so to speak. I do doctor trainings frequently during the year, though I'm starting to get a little worn from it and wondering if I want to continue to do it over the next few years. And as I started to say that and put that kind of thought process out, I started to get more and more phone calls frequently now from people who want to do the trainings. Don't ask me why, but that's how the universe works. It gives you what you want as well as what you don't want. So I'm just going to remind you to call Promo Life at 888 742 3404. 888 742 3404. Make sure you mention you heard about it here on the show and get set up for ozone therapy home care that you can do. Then Doctor's Biome. Well, mesenchymal stem cells, you need a healthy gut. If you don't have a healthy gut, you will not easily be able to make mesenchymal stem cells. Go figure. Doctor's Biome becomes essential then in repairing the gut and helping your gut become into its ideal healthy state so that you can make more mesenchymal stem cells, keeping in mind that the gut connects to virtually every organ and every tissue in your body. It's called the gut-brain axis, the gut-mouth axis, the gut diabetes axis. So by repairing and making a healthier gut, now we've learned stem cells are proliferated into helping in the healing and treatment of these things. Direct IV ozone, however, is because the blood methods of ozone, we still have a lot to try to figure out, can they work as well? Certainly, in my opinion, the blood method called MAH, major autohemotherapy, has some benefits, but minimal. We've done over 45,000 of them between 1990, when I first began, through 1995, the beginning of 1995, and over 45,000 plus treatments, which is a humongous number of treatments. And we found it helps everything, gets rid of nothing. My patients want to get rid of their medical problems, and that's why we transformed into the direct IV method, probably still the most commonly used one throughout most of the world, because it's the least expensive, fastest, easiest, and when done correctly, proven safest way of doing it. Certainly proven safer than MAH. Nobody has ever died from direct IV ozone when performed by a trained healthcare professional. So training is everything. Please, please do not go on the internet to YouTube and say, oh, gee, I can get oxygen and I'll buy needles and syringes illegally and I'll treat myself with direct IV ozone because I just can't get it easily elsewhere. There's nobody around me. No, don't do that. While it seems simple and easy, it has to be done by trained healthcare professionals, not just for the legal reasons around it, but to get the majority of the benefits and, most importantly, safety. The people that have put these videos up that try to make it out to be the simplest thing in the world, yeah, the procedure is absolutely simple. There's no doubt about that. That the procedure is simple, but unfortunately, while the procedure may be simple, it can be risky when done incorrectly. And you think they're teaching you the ins and outs on a YouTube demonstration, but they're not. The doctors that I trained spend 3 days, 21 plus hours of intense training, learning all about the ins and outs of how to do everything that we do safely. So very important that you do that. Very important. That you don't just go and buy these needles and everything. Shoulders, hips, we've repaired ankles, We repair all these things. In addition, there are doctors that do, for example, with prolo-ozone, prostate injections. I get that 3 times a year when I visit my buddy Robert Rowan out in California in Santa Rosa to help him with his group trainings. The ozone can destroy any prostate cancer you have, reduce the inflammation that's in there in BPH, but it's probably the stem cells, in addition, that are doing the repair in the prostate itself. We've seen patients with liver disease get over liver disease because the liver can repair itself. It doesn't need stem cells to do that. But what about kidneys? Well, many people that we have seen over the years that have had damaged kidneys, we have seen ozone therapy repair their damaged kidneys so they can come off their dialysis. All right. Just amazing things there. Thyroid. Many people suffer from hypo and hyperthyroid. The thyroid is not functioning correctly. Well, why do we see normal function start developing in thyroids that haven't been completely destroyed by thyroid medications like Synthroid? Probably it's the stem cells, because there you're not killing off a virus, fungus, yeast, mold, bacteria, parasite, toxin, or harmful free radical. At the same time, ozone will destroy fibroids that might be on there, but it's getting things repaired. Why have we been able to make 7 or 8, actually not 7, excuse me, 8, help 8 women become pregnant without my DNA? My wife loves to, hear that. The answer is they tried to become pregnant. Some of them did and then kept losing the baby. Something was wrong with the systems in their body, so they weren't able to do this. Well, started doing ozone therapy, and within just a few months, they were able to become pregnant and go to term. So once again, what could be working? Well, one of the things they've seen in babies that are born where the mothers, while they were pregnant, though I don't treat pregnant women, I help them get pregnant, is the baby was born with a larger, healthier placenta. So it's apparent that not only is the mother now being able to become pregnant, hold the pregnancy, and give birth, but you get a better birth weight and you get a larger, healthier placenta. In my opinion, it's probably because the stem cells are working to help in the fixing and in the repair. Not so much repair, excuse me, the fixing and the growth is what I mean to say, of the placenta and of the baby. So it's got to be the stem cells, because when we inject ozone into the body directly with direct IV, it's only there about 10 minutes and it's used up. It's gone. So your own immune system's been kicked into work for a couple of hours more, but it has to be stem cells that are really doing most of the work. If you want to get, by the way, Doctor's Biome, which I didn't emphasize enough on this show, which I should have, we're running out of time, that's very special probiotic. All you have to do is go to doctorsbiome.com, DoctorsBiome.com. Doctors Biome, sounds like BioMe, doctorsbiome.com. And if you put the code radio20 in, you'll get a discount off your first order. And then you can continue to get additional discounts using the coupon when you go to check out. If you go on to auto ship, it's worth it. 100% money back guarantee. You have everything to gain and nothing to lose. I promise you won't be sorry. Okay, you won't be sorry. All right. If you have more questions about this, You can go to the American Academy of Stem Cell Physicians, contact them if you have to, tell them Dr. Robbins sent you. They should be able to recommend a stem cell physician near you. If you want to do the injections, if you have the money for it. Otherwise, you may want to learn and find a doctor that does direct IV ozone therapy near you, or tell them to get training with me so they can do the direct IV training, do rectal insufflation at home. These are the things that you're empowered now to do. If you have questions, suggestions for other shows, by the way, I'm also on WNEW FM radio, their HD channel 3, HD3, Saturday mornings at 9 a.m. So you can hear my show there, Saturday mornings, 9 a.m., Functional Medicine with Dr. Robbins. And also on YouTube, Functional Medicine with Dr. Robbins is my YouTube channel where you get to see me, not just hear me. And call my office in Manhattan at 212-581-0101. That's 212-581-0101. And we're in the middle of Midtown Manhattan. They'll put you on to me. I speak with every potential new patient so we can discuss what you may or may not need. You can also email me at ozonedoctor, OZONEDOCTOR at yahoo.com, ozonedoctor@yahoo.com, YAHOO. And with suggestions for shows, doctors you'd like to see on. I prefer to speak to you by phone. Everybody, stay safe, stay healthy, stay well, and have a Merry Christmas and a very happy Hanukkah, which comes up next week. And we'll be on again right after that the next day. Everybody, so long. Bye now.